Hey, what's good? What's happening, y'all? Y'all already know who this is. And it's definitely your favorite soul for y'all. Yeah, Sean coming back at you again. And y'all, you already know we're here with the artists of the week every week. We got the motivational speakers, the authors around the world. Y'all, we're gonna switch it up. We got a doctor in the building for y'all just to tell y'all, look, you don't have to be alone. So with me, we're gonna welcome Dr. Nicholas Jones in the building. How are you doing, man? How you doing?
All is well. What's happening with you? How are you doing today?
It's blessed. It's very blessed. Hey, we get to see your beautiful face, man. So, hey, it's blessed. Y'all don't know, if y'all haven't heard, he's a surgeon out there in Atlanta, all right, based out in Atlanta. You're a plastic surgeon, reconstructive plastic surgeon, as well as a surgeon in the community. Also been featured on Rickey Smiley, all right, so the pole. You've been around the world, man. You've been around the world. So, hey, welcome to you to the P.E.G podcast, man. Looking at your smile today, couldn't be better.
Thanks for having me. Thanks for having me.
All the while. So, hey, before we get started, I'm gonna let you get a chance to introduce yourself to everybody, because if they don't know, they should know Mr. Nip and Tuck. So it's a little brief second for you to introduce yourself a little bit. And then what we're gonna do, we're gonna do a small word of prayer for everybody around the world. You don't have to say who you pray to. Honestly, it does not matter. It's about unity. So we still gonna bow our heads and give respect. So, hey, I'm gonna give you the floor. Tell everybody about
Okay.
it.
Well, thanks for having me. Dr. Nicholas Jones, aka Dr. Nip and Tuck. And I am originally from New Orleans, Louisiana. And
Hey.
I'm now here in Atlanta. I have a plastic surgery practice. It's called Nip and Tuck Plastic Surgery. And I actually opened my practice in the middle of the pandemic.
Wow.
Been open for about 8 or 9 months, and things have been going well. We specialize in aesthetic as well as reconstructive surgery, but I would say 90% of the work that I do is cosmetic, and we do a lot of breast, body, and Brazilian butt lifts. And so I've always desired to have my own practice. And so this is like a manifestation of, a lot of energy that people have poured into me. And now I'm in a position where I can give back more. And so I have mentees, I have students from Morehouse who come and hang out with me, college students, high school students, medical students. And I'm just here in the community, just trying to do my thing.
Hey, that's big. That's big. Shout out to Morehouse. Shout out to the high school kids. That's what's up. I like that. I like that. Giving back. That's why we got to call today in the eyes of the beholder, man. Got to call it that. Beauty is in the eye of the beholder, I like to say, because we can be ugly to somebody else and pretty to another person. So we're going to dive a little deeper. That's deep, man. It's always better to give back to the community. I think that's huge, especially out there in Atlanta. We need it. We need it big, and you're doing big things. So, hey, who inspires you to be a surgeon?
So, interesting question. So when I was growing up, every day my mom would bring me to school. And so she would constantly tell me that I was going to be a doctor, right? And then my pediatrician, Dr. Remedius, he also said I was going to be a doctor. And so when you're young and people ask you what you want to be, because I kept hearing that all the time, I obviously I just say I'm going to be a doctor, and not knowing that that would actually happen. And then so as I got older, and I started to explore, possibilities, I thought being a plastic surgeon would be a cool thing to be, especially because it's like one of the only specialties in medicine where you can kind of own your own business and kind of operate the way you want to. Like you can specialize in a certain area and just stick to that, and you don't have to be confined to the realms of a hospital. And so I just pursued it, and my parents gave me the confidence to believe that I could actually become a doctor, because there was no doctors in my family neighborhood that I grew up in. I mean, it wasn't the worst, but it definitely wasn't the best. Like all of my friends, they either ended up in jail or they were dying. And so it's a true testament of the confidence that my parents instilled into me.
And that's the whole shout out to your parents, because they're the success. So they're who inspires you to be the doctor you are today. Hey, so I know that sound interest, is interesting you right now. You already gonna be up for word of prayer. We're gonna give a word of prayer, give back. And if you want to hear more, you gotta stay tuned to hear more about Mr. Nip and Tuck. So I always like to have the guests to say a little word of prayer. But if you're uncomfortable, you don't want to, that's fine. But would you like to say a word of prayer?
Yeah, sure. Let's do it. Let's do it. All right. God, our Heavenly Father, I thank you for this day. I thank you for this opportunity to give my story to the public. And I pray to you, God, that someone out there is listening and they may receive this. And hopefully it can be some inspiration, some education, some knowledge, so that they can take their lives to another level. Or if there's someone who's interested in pursuing a career in medicine, or not even just a career in medicine, but just a voice so that they can change their lives. And these things I ask in the name of Jesus. Amen.
Amen. Amen. Powerful prayer. So if you ain't get hyped up by that, hey, you got to stay tuned for more, because my man's going to drop that fire on you. So what age, just very, very curious that your parents like been putting this in your mind. So what age did you realize what type of doctor you wanted to be?
Oh, so I from the moment I decided I want to be a doctor, it was always plastic surgery. And at first it was very superficial. Like I was like, I want to be a fly, because I thought they would fly. I thought they made a lot of money, but I didn't really know what exactly they did. And so when I got more attuned to the field, and especially when I actually entered medical school, what was so cool about plastic surgery is you can operate on a person and you can see the results, the efforts of your results immediately. And for the most part, it wasn't like anything life-threatening. The patients were healthy, and you didn't really have to, take care of really sick people. So that was really attractive to me.
More of a safer way, I guess you would say, to please people.
Not really safer. It's just taking care of healthy patients. Like I personally didn't like taking care of like sick people, like cancer patients, or like little kids. That was always, I thought that would be difficult. And the other thing is, if you know anything about the cosmetology world, or like hairstylists, let's say you go to a hairstylist or a barber and you ask for a certain cut. You can go to like 20 different barbers and ask for that same cut and get 20 different looks. And so plastic surgery is kind of like that. Like there's so many different ways to solve one problem. And so there isn't really right answer. So it's more like it's a science, but it's also an art.
Oh, okay. More like it's like you said, it's a way that you can basically put your stamp on it, I guess.
Yes, put your stamp on it.
Yeah, I guess when you like certain jobs, you can't really put your stamp on it, but you can put your stamp on with this.
Right.
That's what I actually thought about it in a way. That surgery, especially plastic surgeons, they do it. It may not look like the other plastic surgeon. Like I never thought about it that way. So that's a good way to put it. That's dope.
Yeah.
That's dope. Put your stamp on it. And so like when you started doing this, I know it took a lot of time, even in school. So how many years did it take you in school? And then why did you sacrifice that time?
So timeline, college, I have a bachelor's of science in chemistry, went to Xavier University of Louisiana.
Hey,
that was 4 years, 4 years of medical school. So we're up to 8. And then after I finished medical school, I did a general surgery residency, which was 5 years. So now we're up to, 13 years.
13 years.
After I did the general surgery residency, did a plastic surgery fellowship. That's another 3 years. So that's 16 years. And then after that, I did another fellowship for 1 year. Yeah, so it's a lot of time. It's a lot of time. And the other end of the question was what?
It was why did you decide to sacrifice that?
You know what? Because I was committed to it. Like
Mm,
I think for me, like once I decide I'm gonna do something, I just do it. And part of the reason that I actually, entered medical school, it was sort of a competition. It was the competitive nature in myself. Like
mm,
I attribute a lot of it to basketball. Like basketball was my thing. Like I loved basketball. And so
yeah,
I was always undersized. They used to call me Peanut. And so I never forget it when I was in high school. One day, an assistant coach, he said to me, Peanut, like, what are you gonna do when you graduate from high school? I told him I was gonna be a doctor. And he laughed at me. Like he like laughed like that was like impossible. And so, and mind you, this is a private school. This is a Catholic school, a
mm,
Catholic all boy high school, in which my parents are paying tuition for me to go to. And the assistant head coach is telling me, laughing at me when I say I'm gonna be a doctor. And
that's
so I took that to heart. And then I also had a teacher named Mr. Lazar. And he was my calculus teacher. And they used to post all of your grades on the wall, like after tests. And he said, he pulled me aside one day. He's like, son, do you want to be mediocre for the rest of your life? And at the time, I didn't know what the word meant. I went home, looked it up in the dictionary, and I was like, damn, that's not me. And so from that point, like I made all A's till I got into college, and I continued, and then that was a wrap.
hey, that was your thriving point right there. That was your burning point.
Yeah, he changed. The dude changed my life, and he did it. It was so I found it to be so instrumental that even after I graduated from medical school, like I sent this guy a letter because
Mm,
it meant a lot to me. Because I before that I was just going through the motions. Like I thought I was pretty smart, but I never really tried to do better.
right. It was no
Right.
challenge. He challenged you.
Yeah, he challenged me. And sometimes, some people, that's what they need. Some people need to hit a reality. Some people respond more to motivation. But whatever it is that drives your engine, you got to get the engine started.
Would you say there's more to the competitiveness in you that when he said that, he was like, nah, I gotta show you differently. And would you
Right,
say
right. Yeah, because I've always been like, I thought I've always been a pretty hard worker.
right,
But like for basketball, because I wanted it so bad, like I would like practice all the time. And I think in order to be good or great at anything, it takes consistency, motivation, and practice. Like you just have to keep doing it over and over again until you perfect it. And
right?
so that's so for me, it was just like somebody telling me I couldn't do something. I had to I I I feel like I had to prove them wrong.
Hey, it was more so you had to prove them wrong, prove yourself wrong, just see if you can do it.
Right,
So that's
exactly.
that's what's up. So when people come to you about any like plastic surgeon or a plastic surgery question, what is the advice that you give them before you even do anything?
You mean as far as like patience?
Yeah, yeah, or like yeah, if a patient come to you and say, "Hey, doc, I'm looking to get surgery or get some of your work done," what is the advice that you give them before you even start?
So for me, anytime I see a prospective patient, I always uh, want to know what their motivation is and what their end goal is, because I don't want someone coming to me seeking plastic surgery because someone else wants them to have them, like a loved one, a spouse,
Mm,
a boyfriend, husband, wife. Because if someone else is your motivation to have surgery, you're not going to be happy. And then the other thing that I take into consideration, I need to know what their expectation is and if their expectations are realistic. Like if you come in, you want plastic surgery and you weigh, 300 pounds and you expect to have a surgery and end up looking like some IG model, then I'm probably not the plastic surgeon for you. Or if you come in and I can't find anything physically wrong with you and you're telling me you really need this because it's killing you, then again, I'm probably not the plastic surgeon for you.
And is that for, like you said, people that's over that weight to come in and you're like, no, do you get most people come in that way?
What? What's that?
When, you mentioned that if I'm weight, then you're doing it for that, or you want to look like an IG model, but not really understand the process. Would you say that would be difficult? Do you get many people like that?
So I think so with social media and the way that, celebrities have sort of, I'm not gonna say glorified, but they've made cosmetic surgery more acceptable. And
Right.
so now a
I
lot of
agree.
people, they want to look like, their favorite celebrity. And it doesn't matter what your size is. Like some people, they don't have the because of lack of knowledge, they may come in thinking that they're going to have one surgery and they're going to end up looking like uh real Kylie sister, or they want to look like Kim Kardashian, or they want to look like Jada Waiter. Like
Mm,
I have patients, we call them wish pics. They come in, I had a patient come in with a poster of
mm.
all the body, like about 20 different body types that she wanted. She wanted her result to look like that. And I mean, if I feel like I can get you that result, that's fine. But, many patients, they come in and they want these looks and it's just not realistic.
And what about the doctors would you say that takes them to that, from that, I guess, overweight or unrealistic points, and then put them in realistic positions? Do you see more health problems, or that's just something that you do? You don't highly recommend it?
So I think plastic surgery isn't for everyone. Like, first of all, you have to be healthy. And we just want to, first of all, I want to make sure that I can safely do your surgery and get you the results that you desire. Like,
Oh,
for whatever reason, if I don't think I can get you the results, or if there's another way that I can help you get to the point where we can do the surgery, then we can do that. Like, for example, some patients, they may be a little bit overweight, or they may be severely overweight. So we can get you on a weight loss program and get you down to a reasonable size. And I feel like I can operate on you and get you the result you want.
mm,
Then let's do that. Because to me, it's not just about doing the surgery. It's also about you, like, changing your lifestyle. Like I have a lot of patients, they get their plastic surgery and they're so happy with their results that they want to maintain it.
right.
And so when you have a patient like that, that's a great situation because you made them more confident about themselves, and now they've changed their lifestyle. And so now they're eating healthier, they're exercising because they're trying to maintain that look.
Do you have any ones that get the surgery and then don't maintain that
Oh,
lifestyle?
absolutely. That happens. Yeah, that happens frequently. I mean, not frequently, but I would say, like, for patients who get liposuction.
Oh,
Uh, for example, I had a patient that I did a Brazilian butt lift on, a younger patient, and she came back and she said she was unhappy with her results.
mm,
Now, she gained 25 pounds after she had the surgery. Like 6 months later, she comes back, she weighs 25 pounds more. So obviously, I mean, your result isn't going to be the same. Like
right.
you have to do your part.
That's crazy. I think a lot of people do that, because I had a cousin who did that. She went through lipo, and swear to God, went back the same size. And I was like, what's the purpose? The purpose. So many people go through that and they go eat the same thing. And it's like, well, you're going to go get the same results you was getting for like 30 years, 20 years. You're not going to get that new result. Like
Right.
the whole lifestyle, especially if you get the surgery. and you had to go through a program. I didn't even know that part. If you're overweight, you may have to get on a program to even get your lifestyle together and then have the surgery. You went through all that, and then you go back and eat the same thing and not maintain the lifestyle. That's crazy.
Right.
Crazy. Well, I mean, that's good for the business because they gonna go back get this.
Right. Yeah. I mean, operating on a same patient more than once, yeah, that's good. But when you're redoing the same operation, it can be more challenging. Like if you do liposuction, even though you don't really have scars on the outside, you may have some little small incisions from where we insert the cannulas to suck out the fat. But
Right.
underneath the skin, I mean, there's some scarring. So every time you go back to do liposuction, it may be a little bit more challenging because not only is there fat, you're going through scar tissue to take out more fat.
Oh, that's that I'm like you. I wouldn't ever want to keep repeating that same situation for to keep.
Right.
So how long would you say the recovery time? That depends on the type of surgery they're getting?
Absolutely. So, for the more invasive, obviously the more invasive the surgery is, the longer the recovery time. Like if you have liposuction, you can go back to work earlier than if you had a tummy tuck.
Oh, for the mummies that want a tummy tuck. So what's the difference between a tummy tuck and lipo? I don't know. I never had either one of those. What's the difference between a tummy tuck and lipo?
So liposuction is just removal of fat using like a vacuum assisted device. So you make really small incisions, you stick a cannula in, and you're essentially just sucking out fat. A tummy tuck is actually cutting out fat from the belly. Like you make a long incision and you lift up all the extra skin, you remove it. In addition to that, you're tightening up the muscles of the abdomen, like your ab muscles. Usually, especially in women, after pregnancy or after aging, just part of the natural aging process. The rectus muscles are usually like this in the center, but they get separated. And so part of the tummy tuck is bringing those muscles back to the middle and recreating an hourglass shape.
So does the age matter? Like, well, I know age matter. You have to be a certain age to start for the surgery, but as they get older, does the age matter as far as risk, I guess?
So your chronological age matters, but it's more about your health.
Okay.
Your health status. Like if you're a 55-year-old healthy person, as opposed to, I would take a 55-year-old without medical problems over a 35-year-old with diabetes.
Okay. So I guess the risk, like you said, the higher the health, the risk of the health. So what would you say would be the most challenging thing out of surgery that you've done on a patient?
Most challenging?
If you had challenging, like good with the hands.
No, there's always challenging cases. I mean, because there's no one operation that's the same. Like as I mentioned to you about, barbers and hairstylists, I can do tummy tucks. I can do 30 tummy tucks and do them 30 different ways.
Right.
So as far as challenging cases, I would say for me, it was when I first finished my training. I did a reconstruction case on a guy who had a palatal cancer, which is cancer of the roof of your mouth. And so he had a hole in his mouth because they excised or removed the tumor, and I had to reconstruct his palate. And it was a challenging case because I had, just finished my training, and I had to do a microvascular case. And so basically, we took some tissue from his arm along with the blood vessels, and we set under a microscope, sewing these really small, like these 4-millimeter vessels together and putting it inside of the roof of his mouth to reconstruct it. So that was like a 10-hour operation. So it took a really long time, but I
So
was able to get it done.
that sounds very difficult. I ain't gonna even lie to you. That sounds very difficult, but you got through it. Have you ever done another case like that, or just that one?
Yeah, I've done more reconstructive cases, but not any more of the face or the head neck area, because I no longer work in that same setting.
Oh, okay. Okay. Okay, I get that. Dang, that's crazy. I don't think I ever heard of that before. Well, I'm not a surgeon, but that's pretty dope to have to do micro sales. You know, I've never heard of that part before. So, hey, kudos to you, man. That's some superhero type stuff, because I don't even know how to do it. Well, where to start? Well, in school, how long did it take you for that part when you went to school for the reconstruction? How long did that take you?
So the plastic surgery residency, all of us, it's 3 years, and then
3 years?
I did a microsurgery fellowship, and that was 1 year.
Oh, okay. So that was the 3 and 1 year you was talking about. Okay.
Right.
So what makes you different from all the other surgeries? Like you said, you can do surgery so many different ways, and no other surgeon is just like you. But what makes you different from the surgeons?
From other plastic surgeons, I would say it's probably, my personality. I think I'm an outgoing person, and I mean, not to say that other doctors don't care about their patients, but once a patient comes into my door and I operate on them, they're like part of my family, and
Mm,
I make it a conscientious effort to try to provide them with the best possible service. And I'm honest with the patients. I'm very approachable. And then when people come into my practice, the reason I opened up my own practice is because I want it to be complete. Like
mm,
from the time you walk into my office to your last appointment, I want it to be a, a wholesome experience. So I would say it's my personality, and then just the level of service that I provide. And
right.
I'm always trying to take it to another level. Like I'm never satisfied. Like I think I'm good at what I do, but
Right.
I'm trying to keep go up the ladder to like, and I know that I will never be perfect, so I'm always striving to get better.
Right. Man, you trying to top the microsurgery part? How can you top that?
Well, I mean, just I'm talking about like my results, the patient experience. Like I always want it to get better. Like
Oh,
there's always room for improvement.
yes, it is always, and being your personal PR, your personal record. Tapping into that you want to see if you get better. I was better at this last year, but I'm even great at this year. So that's dope. Hey, with those talents and skills that you got, you also had modified a technique in surgery. Don't make me butcher it, but I know you call it a Pexy. It's Pexy at the end, but don't make me butcher it. Oh, what was that?
So when I was in my training, in my plastic surgery training, I wrote a paper about a procedure. It's called Buccinator Pexy. And basically it is a procedure done to create dimples. So a lot of mostly women want this procedure done. This is something that you can do in the office and create dimples. And so I just wrote a paper and published it in one of our peer-reviewed journals.
That's dope. I was sitting there looking at that word like, ooh, don't let me butcher it. Even when I started first time, I was like, man, I don't even know what that means, but that don't make me butcher it. I got natural dimples. Natural dimples.
Yeah.
A slight over there. That's what's up. That's what's up. So outside of surgery, we put away the doctor coat. Who are you? Like, what is life outside of surgery?
Outside of surgery, well,
Yeah.
I mean, right now is mostly I would say most of my life is my practice in surgery. But when I'm not at work, what do I enjoy doing? I love to eat. So like dining, like I'm always going to new, like I'm probably the plug for restaurants. Like if you ever come to Atlanta and you're looking for a place to eat, I could give you some great places to eat. I have a new dog, a little puppy. So I'm
Mm-hmm.
spending a lot of time with him, trying to get him trained so he doesn't pee all over my floors. Um, I spend time with my family, and I like to travel. And I'm like I mentioned to you earlier, basketball. Basketball is my thing. I've always loved basketball. I
Oh,
feel
with it,
like if I wasn't a doctor, I would probably be a basketball coach.
basketball coach.
Yeah.
Hold on the court.
I'm a beast on the court.
Hey, they obese on the court. Even with the doc on. Hey,
I'm a beast with the left, and I hit him with the left hand.
hit him with the left hand. Hey, you're gonna come see what that's about. You're gonna see what that's about. You hit him with the left hand. You like threes or you like taking it to the goal more?
I mean, I'm not that tall. So but you know what? I come in the lane. I come in the lane, but I usually like to, hit him with the jump shot.
Okay, so not that time. Hey, some be trying. I know short people that try. They go in the hole and
But
get
I'm
it.
not short though. I'm tall.
It's just not what NBA tall.
Yeah, I'm NBA tall. I probably could have gone to the NBA. At least
Okay.
my mom said I could have gone to the NBA.
Hey, okay. All right. Doc got here balling on you. Stop playing.
Bowling on them.
So what's the most gratification thing you can say? Like any word of gratification. What can you say is gratifying for you when it comes to transforming bodies, because you can do it in so many ways. So what you like the most?
What do I like the most? I
Yeah.
mean, what's gratifying to me is when a patient is happy with their result, and I've been able to restore their confidence, because help them, I'm not going to say I restored their confidence, but help them restore their confidence so that they can go back into the world and be the best possible version of themselves.
Okay. Hey, that's like you said, it's just like when you get that new haircut, because you get a wrong haircut, they ain't gonna feel you, they ain't gonna have no confidence. But you give them that right haircut, okay. Yeah. I like that. I feel it. So like you're not the only doctor in the building, well, let's say in the world is out here, putting plastic surgery and meeting with people. But, as African American surgeon, what could you say was difficult about coming into the game for you?
Oh, I would say the journey in itself was a challenge, because I feel like as a black man, as a black person, that I've always had to go the extra mile. Like I had to do more than my white colleagues to prove that I belong in a conversation or belong in the field. And like people doubt you, and until they give you a chance, and they're like, oh, okay, like he's legit. Or like
Yeah.
even when I show up to sometimes to the surgery centers, they ask to see my ID. Like like they don't know. I know, I know for a fact they don't ask, my white counterparts, or they may speak to me differently. Like the receptionist calling me by my first name. Like like, I mean, it's I mean, I personally, I don't, it's not a big deal to me, but I know for a fact you don't call the other doctors by their first name. So why are you calling me by my first name? It's disrespectful.
Right.
So you have so it's been a long journey, and to this day I still feel like, as a black plastic surgeon, that there's a lot of adversities that I face, and even my patients, like black patients, like we don't get the same quality of care that other people get. Like, you know, even when I was in my residency, I felt like my program director, you know, treated people of color differently than he treated uh, white patients. And so there's definitely a disparity in healthcare, and it expands across all boards. Like, you know, I'm included in that as a physician.
Medical is definitely a hard thing to be in, because I know even as nurses and LPNs and all that diversity inside the hospital. Myself, I was a healthcare administrator for the COVID happened, and that itself has diversity in it. You know, so now you talking about being on the surgery floor and being just as smart as your counter. That itself is adversity. So the fact that you're facing it and you've been an example for others like you, that look, you can be of color and be in the surgery room, and it's okay, you know, to know what they know, and you stand up for yourself, because there's so many kids around the world that wants to do surgeons, like you said, and maybe don't have the confidence to do it. You know, so now
Right.
you're an example for them, and that's dope. So what are some future projects or programs that you're working on inside the community?
So I recently became a member of the 100 Black Men of Atlanta, and
Hey,
so it's a nonprofit organization, and it just focuses on, you know, Black underprivileged youth and just exposing them to various fields and finances. It's just an empowering group of individuals that's just focusing on elevating, you know, underprivileged youth so that they have opportunities and expose them to things that they wouldn't otherwise have been exposed to at an early age, so that they can become doctors and become engineers and go into fields that they otherwise wouldn't have known about.
right, right,
And not
and
only that, but it's also just like educating them about financing and investing, so that, you know, overall we're just elevating the Black community to another level. Because right now, I mean, that playing field, I mean, let's be honest, the playing field isn't even, and I don't anticipate that it will ever be equal, but we can keep making moves to kind of balance things out.
that's true. That's true. And what would you say to the people that say, "I want to be like Mr. Nippertuck. I want to open my own business. I want to be the next, you know, plastic surgeon," but they scared. What would you say to that?
I would say don't be afraid and to pursue your dreams. And probably one of the most important things is to continue to explore. And if you don't know how to get there, just ask. Like
Hmm.
just do some research. All it takes is that you just have to take the initiative to start. And to accomplish anything, you're always going to need help somewhere along the line. So
Right,
reach out for individuals. If there's something that you really want to do, try to change your atmosphere, your surroundings, and be around people who are doing something that you want to do. Like if you hang out with a whole bunch of bums, you're probably going to end up being a bum. If you hang
right,
out with a whole bunch of drug dealers, guess what? You're probably going to be a drug dealer. So you got to put yourself in the right situation and just ask the right questions
right.
and just pursue it. Like just try to find out as much information you can and then go from there. And like I said, everybody needs some help along the way. So a good mentor uh, helps out a lot.
Means you're 100 organization is straight guys, right? And as you
No,
said,
no,
no.
I mean the organization is all men, but we provide services to both both boys
Oh,
and girls. Yeah.
okay. So community, so you brought the whole community in, not just black male, but
Right.
oh, okay.
Right.
Really dope. We bring in more resources to the community. That's really dope.
Right.
Um, I teach how to give them some skills, how you do that. The micro, that's still in my head. I'm trying to figure out how you do that, how you sew sales and stuff together, man. Like Okay.
Not cells, like, but just very small blood vessels.
Oh, the blood vessels. That's small. That's
Right. It is. It is.
small. Man, hey, it definitely take you to do that because if you tell me you like to dissect frogs, I skipped that part of biology. Now, I was that person that did not show the class for that every time.
Oh wow.
I don't like frogs. Did they dissect the pig? Maybe, but the frog part, I deal with. Did you have to dissect the frog ever
I think so in college, maybe.
in college?
Yeah, in college, yeah.
That's
But
funny.
I was a chemistry major, so I
Oh,
took the minimum amount of biology courses that I only took those that I needed to.
oh, you had long problems in chemistry.
Yeah,
I
yeah.
remember chemistry. Ooh wee. So, hey man, all those risks that you talked about, even with surgery, clients coming in wanting to know how to get the surgery, even if they're healthy or unhealthy, you're able to give them the advice that best suits them in their life. And all this, we went through risk and confidence to keep the person going. And like you said, that lifestyle is needed to keep it. So, what would you say would be one of the side effects that you've seen inside those surgery room that you say would be the biggest thing? Other than the health part, like whether it's after surgery, you seen some don't really snap back as fast, or you see, I don't know, high blood pressure. Is there anything other than you like that lifestyle that you say they have to keep that keeps someone from having that surgery?
Can you rephrase the question?
Yeah, sure. So like with the lifestyle, it's a lot. You know, you gotta stay healthy. You gotta be on your
Right.
P's and Q's. So out of all that, from certain some risks that you've seen that when people don't keep their lifestyle, of course they lose their lifestyle. What are some health risks that you may see that they have
Like a reason why, a reason why I wouldn't perform a surgery on a patient.
after their surgery? So once they have the surgery, right, and they come back, is there any health risk that you see after the surgery other than they don't?
Like complications from surgery?
Yeah,
Yeah,
yeah.
so I mean, for each and every surgery, there are some like inherent potential complications.
Okay.
Like, for example, if you have a tummy tuck, some of the most common complications after surgery are seromas, which is a collection of fluid underneath the skin.
Mm.
Sometimes they can have wound complications, like part of the wound may not heal. And one of the worst complications is blood clot. Like they can have a blood clot and it go into their lungs, and they can have a pulmonary embolism, and
Mm.
you can actually die from a pulmonary embolism. So
Yeah.
that's like the worst case scenario. And so typically, like the more common ones, like wound healing issues. Sometimes patients have irregularities, like the shape may be abnormal, and
Right.
the in infection, like wound infections.
So
And
what did
so,
that would
what do
be
you?
the would that be the key reason why the lifestyle is important?
Um, well, lifestyle is important, but I mean, your health. Yeah, yeah, that is part of the reason. But you know, for
Okay.
some patients are more prone to certain types of complications. So it's really important when a patient comes in that they're completely honest about their health. Like
Oh,
if you smoke, you should definitely let your doctor know that you smoke, because smoking can cause wound healing issues. If a patient has had a heart attack before, or or let's say a patient is on a blood thinner, like all these things are things that need to be known, because it can potentially affect your outcome. It can potentially, lead to a poor outcome. You can have problems in the operating room, so that's why we spend some time together. We check your labs, and once we decide to have surgery, it's an agreement between myself and the patient. Like the patient has to be committed to doing the things that they need to do to get the best possible outcome, while I focus on doing what I need to do to try to get you the best result.
See, that was my mother-in-law. She wanted to do like, I think a surgery, something like that. I guess it was lipo, and that was the one thing the doctor was working with her about the smoking. She had to quit smoking. You know. And is there like a time where we see people that smoke and they want to have the surgery done? Is how long does it take for them to like not smoke to be able to get surgery, or they can?
So it just depends on the procedure. Like for some patients, if they smoke, if they're active smokers, I won't operate on them. Like, because I'm trying to get you a great result. And, sometimes it can be difficult to get a great result. So if I can minimize any sort of control risk, then I will. So if you smoke, then you shouldn't have, I don't think you should have surgery. If you're not willing to quit smoking so that you can get a good result, then I don't want to operate on you, because I don't want a patient coming to me and say, hey doc, like, oh, like this is terrible. I have dead tissue at the end of my incision, or my wound opened up. Well, I mean, all those things happen, but you were actively smoking, or you got a blood clot. So, I have to, risk stratify all the patients, or every patient, just to make sure, we're limiting any potential complication as much as we can.
Oh, that's dope, man. Just let's listening on and just being part of this podcast and me with you. I heard so much as far as like surgery, because I hear so many people say, like I said, I never had a tummy tuck or lipo or any of those things. So I just hear and be like, okay, what's the risk to that? And so many people do it and want that IG body that you talked about. So man, like from the risk, from the health, if y'all want this, y'all gotta get healthy. That commitment is there. It's like waves. You know how much it is for waves? Boy, it's more than regular hair. You have to brush more than regular hair. So the commitment you gotta have to get this lipo or get this surgical body, you gotta have it like brushing waves. If you don't want waves bad, then you ain't gonna have no saucy wave. If you want the lipo, you want the surgery bad, you gonna go get healthy. Man, my mans can't work on y'all if y'all not healthy. So man, Dr. Nip and Tuck, Dr. Nicholas Jones, man, that's a ring. That's a ringer right there. If they not using your name to come to you, they say, hey, I got my Nip and Tuck by Dr. Jones. I don't know. I'm gonna be like, nah, you ain't get the right person, You get the right person. So Doc, leave a message that's gonna resonate with us. Even when people get off and they say, hey, you remember Dr. Nicholas Jones? What you gonna say? Make them remember you, man. Even after all this, because even the lipo should have grabbed them by now. But if that didn't grab them, what would you say?
I would say be the best possible version of yourself. And I would say, it doesn't matter what you're doing in life, there's always room for improvement. So whatever you decide to do, just be the best at it. In order to be the best, it takes a commitment. It takes lots of practice, lots of prayer, reading, and just, focusing in and zoning in on your craft and ignoring all of the distractions. Like, focus.
Yeah, amen. Next time I'm like, am I committed? I'm gonna think about you.
Think about it,
man.
I got a question. What is that on your neck? What is that? What does that say?
People, Black Lives Matter. That's what it says.
Okay, Black Lives Matter.
Power to the people. If my kids gave me, I love it. You know what I'm saying? I love it. But yeah, man, power to the people. That's what I read. Power to the people, man. We got to get more out there. There's so many Black Americans out there doing wonderful things. Like my man, Mr. Nip and Tuck over here, doing wonderful things, man.
Hey.
If y'all committed, I'm gonna always point this out, bro. If they are not committed as you were with those vessels, I don't know what to say, because you had to sit there for 10 hours and make sure somebody come back and their roof of their mouth is all good. So, hey, if y'all ain't committed about that when it's your finance, y'all not like that with anything y'all do, y'all not on the way like Mr. Nip and Tuck. Y'all don't want to be committed to the game. I'm committed to the game, man. You made me rethink the whole thing when you said that. I'm like, he said that for 10 hours to do that? That's great.
Yeah.
Hey, but I bet you it made you look at your skills a lot different, you know? Like, man, I completed that. That's crazy, man.
Yeah, that was tough. It was tough.
It was that. Yeah. What would you say would be the toughest thing about that? Like, were you scared?
No, I wasn't scared. It's just, so when you're in training, there's always there's a plastic surgeon, like professor, who's kind of holding your hand throughout the whole thing. Like, they won't let you mess up. But
Okay.
if you can imagine, like, you know, you completed your training and you're all on your own. There's no one like you turn to and say, hey, like, what do I do next? It's just you. Like, you're in charge. Like, everyone in the room is looking at you to figure out, like, you tell them what you want them to do or how they can help you. And so it ends with you. So you got a patient on the table. Patient has signed their name, giving you permission to do an operation on them. So they have confidence in you. Like, they've given their life over, put their life in your hands.
Right.
So that's a huge responsibility.
Hey, now they here. They still here to, and
yeah,
magical hands, man.
I don't know if they're magical. I mean,
in my mind,
this is I'm just a vessel. I'm just trying to do God's work while I'm here on this planet.
Yo, hey man, if y'all ain't getting no value today, I don't know what to say. Cause my man Dr. Jones came and put that sauce on y'all, man. Keep on doing
sauce, lots of hot sauce, lots of Louisiana hot sauce. On fried catfish. Catfish.
On the fried catfish, man.
With some potato salad.
On the side. On the side.
Actually, with spaghetti. I like catfish and spaghetti.
I'm on your side. Catfish and spaghetti. I'm on your side. I'm hungry.
With hot sauce.
With hot sauce. That's how he did it. He made a full course meal and threw the hot sauce on there for y'all. And now y'all can't say you don't know what a lipo is. You can't say you don't know what the mummy tuck is. We all know now. And we know
tummy tuck.
Tummy tuck. I call it mommy tuck. Tummy tuck, man. Tummy tuck.
Right.
I want to go get y'all tummy tucks. Y'all want more information about it? Hit up my man, Dr. Jones. He got y'all. He gonna let you know what's safe for you. And if nobody love y'all today, tomorrow, or yesterday, I love you. Dr. Jones love you.
I love you. I love y'all. I love my people.
Yeah, ain't nothing y'all can do about it. So hate us today or tomorrow. We still gonna love y'all, man. Hey, and thank you for coming out to the P.E.G podcast, y'all. I appreciate it, man.
All right. Well, thank you. You have a good evening. Hey.